I would like to introduce Jimmy Fallon and David Letterman. We are fortunate here in Ulster County to have an incredible group of people that collectively make up not just this event, but a group that is committed to volunteerism and changing the lives of other people. So we truly are blessed. Thank you to every volunteer who is here with us this morning for all that you do. You change people's lives. There's no way that as elected officials we can ever say thank you to a volunteer who individually changes the course of someone's life because of their actions. For that, I am eternally grateful, and our entire community is eternally grateful. Now, here in Ulster County, I'm pleased to say, in many ways, we are on the leading edge of health-related issues. We are working to become the healthiest county in all of New York State, and I'm also proud to say we are moving forward in conjunction with the American Cancer Society with legislation to protect our children by creating school zones. In those school zones, it will prohibit the kind of predatory advertising by large tobacco companies designed to get children hooked on cigarettes. I'm proud to say we have a wonderful legislature committed to moving forward with this exact program, and I hope to be here next year with you telling you that we have this program in place. But you are with a wonderful group of legislative leaders throughout the state who are committed to a single cause, and that is making sure we put an end to cancer. The only way that can happen is a collaborative effort to take on an insidious disease that is perpetually changing. So with that, I can't say again, thank you enough for your efforts to come here today. Thank you for helping us move in the direction of making Ulster County the healthiest county in all of New York State. And I hope that you enjoy today's program and you find it incredibly informative. We have wonderful speakers here today, and thank you again for allowing me to speak. Bye-bye now.
Good morning, everyone. It's my pleasure to welcome you to our live American Cancer Society Cancer Action Network Community Talks Cancer Talk Show. Today's program is not only being recorded for Time Warner Cable's on-demand channel, but it is also being streamed live online for our online viewers. Before we begin our show, I'd first like to recognize our amazing committee who worked very diligently to bring you this morning's Community Talks Cancer show. I ask each committee member to please stand when I call their name, and if you could hold your applause in the interest of time until everyone's introduced, that'd be great. John Finch, Nina Postupak, of course Neil Eisenberg, Jeremy Ellenbogen, who's behind the scenes as always, and our talk show host, Ward Todd. And Sandy Cassesi, Vice President for Oncology Services at HealthQuest and Secretary of the National ACS CAN Board of Directors. And our American Cancer Society Cancer Action Network partners include the following: Teresa Tolakansky, Teresa is here. John Anthony Bruno, John is here, J.A., and their ACS team manning the registration table. Thank you all for your commitment, dedication to the American Cancer Society Cancer Action Network. Thank you. I'd also like to recognize and thank Michael Burgess, ACS CAN New York Government Relations Director, Michael, and Dr. Alvaro Carrascal, Vice President of ACS Eastern Division Health Systems. Thank you, Doctor. We also have a number of elected officials that have joined us this morning for our show. Besides our distinguished guests, who you'll be hearing from shortly, I'd also like to thank these elected officials for being here today. Thank you so much for your presence and your commitment to the American Cancer Society. This morning's ACS Cancer Community Talk Show would not have been possible without all these people, and I'd like to recognize those legislators. Of course, our county executive you've already heard from, Mike Hine, if Mike's still here. Congressman Chris Gibson. Congressman, thank you for being here this morning. New York State Senator Terry Gibson. Senator, thank you for being here this morning. New York State Senator Celia Tachik. Senator, thank you. Assemblyman Kevin Cahill. Thank you. And Assemblyman Peter Lopez. Thank you, Assemblyman. I'd also like to thank our sponsors this morning. We certainly couldn't be here without the support of the following gold sponsors. Thank you to Hudson Valley Federal Credit Union, Spencer Daniels Agency, the Ellenbogen Creative Media, Ulster Radiation and Oncology, Orange Regional Medical Center, and HealthQuest. They are our gold sponsors. Thank you so much this morning. Please help me thank our silver sponsors, and they are as follows: Health Alliance of the Hudson Valley, Mid-Hudson Valley Federal Credit Union, Ulster Savings Bank, M&T Bank, Ulster Federal Credit Union, the Ulster County Regional Chamber of Commerce, and Hudson Valley Hospice. Thank you for your silver sponsorships. And I'd like to thank our table sponsorship for the morning, and that is from Rondout Savings Bank. Thank you, Rondout Savings Bank. Neil.
So, thanks, Rick. As many of you know, the American Cancer Society Cancer Action Network, also known as ACS CAN, supports evidence-based policy and legislative solutions designed to eliminate cancer as a major health problem. ACS CAN works to encourage elected officials and candidates to make cancer a top national priority. ACS CAN gives ordinary people extraordinary power to fight cancer with the training tools they need to make their voices heard. ACS CAN is leading a nationwide grassroots movement that advances the cancer community's interests at all levels of government. ACS CAN's determined advocates put a face on cancer and work to ensure that the nearly 14 million survivors of this dreaded disease and their families are seen and heard by lawmakers and elected officials. ACS CAN empowers you to take action, unite our voices into one unstoppable force, and is making cancer a top national priority that lawmakers cannot ignore. Our annual legislative breakfast has been one of the ways that we fight back to highlight critical and timely topics that directly impact the health of our community members. Each year, we gather local, state, and national elected officials to address topics critical to cancer patients and their families. So, we'll be back in a minute to start today's ACS CAN Community Talks Cancer program with our esteemed host, Ward Todd, after a short commercial break. Thank you.
We're better together!
I've been relaying for 10 years because I know that the work we do here on this track and in tracks across the country is helping to lead to the end of cancer. I've also been involved with ACS CAN for 5 years because I know that we can take the fight further. We can fight in the halls of Congress and state capitals and city councils across the country as well. So it's no secret that being involved with Cancer Action Network is not the same as painting yourself purple and running around a track and being a part of the Miss Relay contest and all those sorts of things. It's a little bit different, but it's different in a great way.
We can walk and walk and walk and raise funds, and that's great, and we do a great job of that. But if somebody has cancer and they can't get to a doctor because they don't have the insurance coverage and they can't get a mammogram, then all of our work is in vain.
We're better together.
As a cancer survivor, I've learned that it's very important to advocate for laws that strengthen what we do.
I do think it's important that people go and visit their legislators and talk about cancer-related issues. It helps them to actually be able to see and to have that personal interaction with people from their districts who have a story about cancer.
We're better together.
The money that the federal government is able to spend on cancer research funding is greater than all the relays in all the world would be able to raise. And it's your money. And having an impact on how that money is spent and making sure that it's spent on things that you care about, like fighting cancer, is so important. Relay for Life and the Cancer Action Network are absolutely better together.
Peanut butter and jelly is better together.
Cookies and milk.
Cake and ice cream.
We're better together.
ACS CAN is a branch of the American Cancer Society. It's their advocacy branch.
It was so great to be involved in CAN to help pass smoke-free laws in our state, and now I feel like every time I walk into a restaurant, my son is protected from that, and I did that. As a relayer, it's a way to feel empowered, it's a way to fight back.
We're better together.
When you're out there on the track, they hear you all around your community. Well, they need to hear you when we're in Washington, D.C. as well. We need your voice as a part of ACS CAN to help finish the fight.
No one should have to fight cancer alone.
Come on.
We are better together. Join ACS CAN today.
Well, good morning again, everyone. Thank you again for being with us today. This is a very special day here in Ulster County, and we invite you to stay with us for the rest of the morning. My name is Ward Todd. I'm a volunteer with the American Cancer Society's Cancer Action Network. After the enactment of the Affordable Care Act and its ongoing implementation, we've been hearing a lot of discussion about the importance of improving the quality of health care so it becomes more personalized or person-centered. But that push is complicated by the competing tension of health care. Modern medicine has helped people live longer with serious chronic and complex illnesses, but today's healthcare system is fragmented in a way that makes it difficult to navigate, just when the needs of chronically ill patients are growing at a rapid rate. And today's healthcare consumers are aging, especially us baby boomers, bringing increased healthcare demands and a rising sense of urgency for real healthcare reform. A new and better care paradigm is clearly called for, one that can meet these new demands. Palliative care, which minimizes the pain and stresses associated with the treatment of a chronic disease, is really a key part of that new paradigm and has become a hot topic of discussion for public policy and in hospitals and other healthcare settings, largely because it provides patients, medical institutions, the healthcare system, and clinicians with an ongoing, effective, and inclusive solution to a growing and difficult challenge. That's why palliative care is the focus of our discussion today. New York State actually negotiated and recognized the value of palliative care quite early in the game, enacting a series of comprehensive laws, including most recently the Palliative Care Access Act in 2011. And a federal legislative agenda is also on the docket to expand palliative care research, training, and access. So we'll hear about some activities happening around these policy initiatives in this hour, but first, let's start with some preliminary information to get a sense about what palliative care is and how it can help. To better introduce why this topic is important to the lives of so many cancer families and their patients, and their families, I'd like you to turn your attention now to a great video clip. This is produced by the American Cancer Society. Please stay with us for this commercial.
Palliative care is about relieving the pain, the symptoms, the stress of the cancer experience, both for patients and for their family members.
While the regular team of doctors may be focusing on the illness, whether it's cancer or a heart problem, we focus on the person around that disease.
There's been this extraordinary sea change in how the American Cancer Society has focused on patients' quality of life, focused on their pain symptoms, focused on their psychological distress. Because if we can manage people's symptoms, if we can get them through the treatments that they have, then they can get the best cancer care.
To think about us as a bunch of organs, one of which may be diseased, and if we just treat the disease, everything else will be fine, is really too mechanistic and too primitive in a way for an organism that's as complex and interdependent as a human being.
You know, the treatment of cancer is so complicated and involves so many different specialties. No one person can master everything.
So it's doctors, nurses, social workers, chaplains, sometimes pharmacists to help with the complex medications that people are taking.
The American Cancer Society is the most effective patient advocacy organization on the planet.
Willing to address the issues that relate to cancer patients in pain, willing to teach the public that their pain could be treated, and probably equally important, to be able to support research.
The American Cancer Society, first and foremost, is an advocate for the patient. This is the right thing to do.
Making patients and families aware of what's available is a very powerful step.
So when the American Cancer Society talks about quality of life, it's probably not giving itself enough credit. You know, I couldn't go on and name the different investigators that have been supported by the American Cancer Society to help define the field and create the research that was necessary.
No matter who you are, no matter where you live, what color you are, what stage of disease you're at, you should be able to reliably expect high-quality palliative care in the cancer center, in the primary care practice, in the pediatrician's office.
My great hope for the future is that we will no longer talk about palliative care as if it is an addition. It will be as part and parcel of standard medical care as any other of the advances in the last 100 years.
So welcome back. With us now are David Woodmansey and Rebecca Kirsch. David is the Associate Director of State and Local Campaigns for the American Cancer Society, Cancer Action Network. Rebecca is the Director of Quality of Life and Survivorship for the American Cancer Society. Thank you both very much for being with us this morning on this very important topic. Rebecca, palliative care may be an unfamiliar term to some folks in this room this morning. Let's start by having you explain to us exactly what palliative care is.
Sure. Palliative care is all about treating the pain, the symptoms, and the stress that can accompany cancer or any other serious illness. And it helps support the quality of how people are living across the course of their disease. It focuses on helping support patients and families' quality of life throughout what can be many, many years of difficult cancer treatments and their aftermath. And the clinical studies also show that when you provide palliative care together with cancer care, you don't just have better quality of life, but you also may live longer.
You're doing great work. Thank you for all that you do. Can you tell us a bit about why and how the American Cancer Society has made palliative care and quality of life priorities for coordinated action?
The American Cancer Society has sort of two dual missions about saving lives and preventing suffering. And that's important in cancer because it's such a difficult disease and treatment. And so we took quality of life on because we know from patients and families that treating the pain, symptoms, and stress of cancer, that's as important as treating their disease. And so we've built a robust agenda to bring palliative care everywhere through research, through programs, and through advocacy initiatives. Since 2007, we've dedicated $23 million to palliative care research alone, together in partnership with the National Palliative Care Research Center that sits here in New York State. And we've also built a thriving advocacy agenda and campaign to build more public awareness and policymaker awareness as well about the importance of bringing palliative care everywhere. And the reason that we wanted to make this investment is we know that for patients and families, it's not enough simply to survive. We also want them to thrive.
Great, great. So now, David, we know that ACS CAN has built an entire federal and state legislative campaign around this concept of earlier palliative care. Tell us about the proposals, what they do and how they'll help improve the quality of care for people with cancer and other serious illnesses and the type of care they receive.
Sure, thank you. Well, there are two federal pieces of legislation that are in play right now, and there's one state model legislation that, with Rebecca's help, we created a couple years ago. The first federal piece is the Patient-Centered Quality Care for Life Act, which is HR 1666. And what that does is it looks to defragment patient care and to increase utilization and awareness of palliative care and better coordinate the research that goes on federally regarding palliative care. And then the other bill is the Palliative Care and Hospice Education Training Act, which is HR. I'm not a federal lobbyist, I'm a state lobbyist, so I'm a little out of my comfort zone talking about the federal stuff, but that's HR 1339, and that deals specifically with training the workforce and establishing grants and fellowships so that we can have more professionals that are trained specifically to work in palliative care to help patients and families. Now, the state legislation is I'm a little more familiar with because I work directly on that in all 50 states with our staff and volunteers. But that quality of life piece of model legislation, what it really looks to do is establish a statewide interdisciplinary expert advisory committee at usually in the state capitol that comes together a couple times a year, really focuses on the 30,000-foot level, what's going well in regard to palliative care in the state, where the challenges and opportunities are, and it really allows folks that wear a hat in, say, a hospital or a healthcare setting to really focus on what's going on in the state as a whole and make recommendations that hopefully will move the model forward in regard to palliative care in that state. And the other aspect of the state model legislation is that it asks the state health department to be the arbiter of what is the most recent information that patients and caregivers and medical professionals should know in regard to palliative care at the state level.
Great, great. Good work, both of you. Thank you so much for your contributions, and thank you for being with us this morning. We appreciate it very much, David and Rebecca. Thanks very much. We have a commercial break. We'd love you to stay with us for this. This commercial break is brought to you by our gold sponsors, and they are Hudson Valley Federal Credit Union, the Spencer Daniels Agency, Ellen Bogan Creative Media, Ulster Radiation Oncology, Orange Regional Medical Center, and Health Quest. Please watch this commercial for us.
After the doctor says you have cancer, the cancer patient hears nothing else. There are great tools for treating cancer. Great tools, wonderful tools for treating cancer, but those treatments, those radiation treatments, those chemotherapy treatments still cause side effects that impact patients' quality of life. Palliative care is helping patients who are in treatment for cancer basically be comfortable during treatment, whether that means helping them with pain control or other symptoms that arise from their cancer treatment. At the cancer center where I got treatment, palliative care was really part of the process all the way through. The role of the palliative care physician would be to make sure that everyone is talking. My wife didn't have to worry as much about what I was going through, what the side effects of treatment were, because they were being dealt with as we went through the process. Palliative care doesn't just help people feel better, it helps them get better. And after cancer treatment is over, to lead a quality life.
Welcome back again, and good morning. With us now is our Congressman Chris Gibson, and I want to thank you for being with us. I know you're a busy guy with a busy schedule. Thanks for fitting us in today. We really appreciate it.
No, appreciate the opportunity.
Thank you, Congressman. We want to thank you, first of all, for your co-sponsorship of H.R. 1339, which we've spoken about in the last few minutes. It's focused on building the specialty workforce in palliative care and hospice, while also boosting numbers of faculty available to train palliative care clinical skills. If you would, please give us an update on the status of that bill.
I sure will. And before I do that, I just want to thank all the advocates here and the professionals who work on this every day. I know that this is a passion for you, and you are making a difference. And of course, we're moving along two avenues here. One, curative, and we do that at the federal level through two different avenues, actually. We do that through the National Institutes of Health, NIH, and also the DOD. Not widely known, I think, across the country. Of course, the advocates know, but we make significant investments in the DOD for curative approaches for cancer. And then today, of course, I think very appropriate, you're focusing in on palliative care, which is a recognition of the fact that, you know, we are living longer, and we want it to be a quality life, and dealing with pain, dealing with stress is something that impacts all of our families. We're talking about something that, statistically speaking, really hits all of us, every single one of the families. And so with this bill, this important bill, this is actually, the author is Mr. Engel, who's from New York. We can be proud of that. And there are 117 co-sponsors on the bill. Not only myself, but Sean Patrick Maloney from the Hudson Valley, a number of legislators from New York. This is a very bipartisan bill, shows tremendous promise With 117 co-sponsors, we're getting close to a center mass where this could end up on the suspension calendar, which is the non-controversial bill, so that we can get it passed and sent over to the Senate. I'm hopeful that you'll see that by this summer.
Awesome, great. Thank you for that. Another top federal priority, as we just mentioned also, is this other bill, H.R. 1666. It's known as the Patient-Centered Quality Care for Life Act, and it would improve access to palliative care by expanding public awareness, create new tools and best practices for health professionals, and invest in research to improve patient quality of life through palliative care. ACS CAN would be delighted if you would support or co-sponsor this bill.
Well, I'm proud to announce today and excited to announce that I directed earlier this week, I directed my staff to add my name to the list of co-sponsors. And, you know, this is just a smart piece of legislation because, you know, we're taking advantage of some of the latest breakthroughs, but also being smart about the way we're approaching research. We think it holds tremendous promise as well. And when you look at the data, and there has been some work done on this, we not only think this will make a difference in terms of palliative care, but we also think this is good for the taxpayer too. Because research has shown that getting pain and stress under control reduces the amount of time in intensive care, which we know is very expensive, and also readmission rates, which drives cost as well. So this is just in every regard, it's an important initiative. Proud to be supporting it and look forward to seeing it advance throughout the summer as well.
Great. Thanks for your efforts.
Yep.
On behalf of ACS CAN. Keep up the great work.
Yeah, thank you so much. Good to be with everyone. Thank you very much. God bless
Thanks.
you.
Thanks, Thomas.
Yeah.
Thank you very much.
Thank you.
Thank you, sir. Thank you.
Thank you.
We'll take a break for another commercial now. Please watch it. Some great information for you here. It's brought to you by our silver sponsors, Ulster Savings Bank, Health Alliance of the Hudson Valley, Middleton Valley Federal Credit Union, M&T Bank, Ulster Federal Credit Union, Ulster County Regional Chamber of Commerce, and Hudson Valley Hospice.
I'm an oncologist and a palliative medicine physician. Palliative care is specialized medical care that focuses on patients with serious illness. It provides symptom support, pain and other symptoms that are associated with illness. We're very fortunate to have an interdisciplinary team. So it is made up of the physician, the nurses, the social workers, chaplaincy, and alternative therapies. We have much evidence now to show that palliative care makes people healthier. In fact, in a study of patients with advanced lung cancer, palliative care not only improved quality of life, but also improved survival. We see patients and we get an assessment of what they need, whether it is symptom management, discussions about goals of care and things that are important to them, helping them understand a bit more about what's going on with their care by getting all of the physicians involved to sit down and have a meeting with them. We incorporate the family and caregiver into the decision-making process to make it more of a shared decision-making, as well as focusing on relieving the stress of families and caregivers. There is this belief that palliative care is focused only on end-of-life care, and that in fact is not what palliative care does. Palliative care is important early on in the trajectory of illness. Even as we get better at treating cancer, it's still associated with significant side effects and burdens for patients. Palliative care is particularly important because it's effective at helping patients get through those treatments.
Welcome back again. Now joining us is Dr. Joel Mandelbaum. Dr. Mandelbaum is currently affiliated with Hurley Avenue Family Medicine in Kingston. He received board certification in hospice and palliative care by the American Board of Hospice and Palliative Care Medicine, and taught classes about the role of the physician in the care of the dying person for hospice. Welcome this morning, Dr. Mandelbaum. Thank you for being with us.
Thank you. It's good to be here.
Now that we have a sense of palliative care's value and its role in improving the quality of life for patients and families, let's hear a little bit about what's going on in the front lines, how this works in practice. Let's start with an explanation. Who provides palliative care?
Well, as mentioned before, palliative care is really a multidisciplinary field. It involves a lot of people. The best model of this, I guess, is actually the hospice team, which is sort of the oldest palliative care model in this country. And this includes a physician, a nurse who sees a patient on a regular basis, a social worker who sees to the patient's social, financial, and other family needs, a chaplain to provide spiritual care. And there are often a lot of other disciplines mentioned. We, for example, here have a music therapy program, which has proven quite useful and quite helpful to a lot of patients. So there's often a pharmacist and a dietitian that we also use to care for. Now, the people that I can speak most about, of course, on the team are the physicians. Basically, palliative care was really pretty much advanced initially by oncologists, cancer specialists in this country. They started forming more groups and organizations devoted to palliative care, realizing that there was a great need for that. Not only do people who have palliative care have better quality of life, but they actually can live longer than people who don't. So there's now a specialty board, which is now an official board of medical subspecialties that is recognized. And there is also a specialty certification for nurses in hospice and palliative care. Ideally, of course, palliative care should be provided by every physician and every healthcare provider. And it should be provided not just at the end of life, but throughout the course of illness.
So on a given day in a hospital or other care setting, what would delivery of palliative care services look like? What's involved?
What's involved? Okay, 2 examples I can give from my own experience. One involves a home care patient who at the time was in hospice. He was a 57-year-old man who had advanced prostatic cancer. He was constantly having problems with low energy, low blood count. So I went and saw him in his house. Lovely place to visit. That was part of why I like doing the home visits. And he was having problems with pain, which were well managed at the time, but his problems were with energy, lack of energy caused by both his low blood count and his pain medication. Oh. So we adjusted his medication, put him on some stimulants, which were effective, and also his blood count, which we had found previously had dropped. We arranged for him to be admitted to the hospital for a transfusion. And this sort of prolonged his good quality of life. He still wrote, he still enjoyed his family. Another visit that I did involved a patient in the hospital who was quite terminal. He was pretty much unresponsive but extremely agitated, and he was on very high doses of opioid medication and sedatives, but they weren't working. So his family was very distressed by this. I went in, I saw the patient. We added some new treatments that were effective in quieting him down. The chaplain with hospice also spoke to the family and was very helpful in answering their questions about what we were doing. Was it moral? Was it, to further sedate? Would this, and and helping address their fears and their problems with his dying and with what we were doing at the end of life.
Wow. So I think probably the most important question is, how do patients and families really get access to this very important palliative care?
Yeah. Well, what I'm really glad to hear are all these educational initiatives that are coming along, because to get something, you have to first know it's there. And there, initially at least, was some reluctance also among physicians to have palliative care, but this has sort of subsided. Let me give you an example about palliative care. In the 1950s, I think it was the head of the American Cancer Society at that time actually said something to the effect of, we should not compound people's pain and end of cancer by giving them narcotics medicine and making them addicts. There's been a sea change in this, obviously, and now we know the importance, not only the morality, but also the importance of treating people's symptoms and pain. But first you have to know that it's available. We had a case of an elderly relative who was hospitalized several years ago, and they would not treat her pain because she was a, quote, surgical patient, and they had to reevaluate her abdomen. This at the same time by saying that this woman was no longer a candidate for surgery. So we got the I at least knew to get the palliative care service at the hospital involved, and they made her comfortable. But now, basically, palliative care can be obtained at any hospital. Pretty much, it is pretty much mandated. Locally, there are 4 of us physicians who rotate a palliative care service at our local hospitals. and we do have some backup. You know, we don't have a full palliative care services as with larger medical centers where there is a devoted staff. We can use the hospital social workers and chaplains to get involved. As an outpatient, the major thing is hospice for providing palliative care service now. But again, ideally and with more education, every physician should be providing palliative care to their patients.
Great. Good news. Thanks again for all you're doing, making a difference in a lot of folks' lives. Thanks, Dr. Mandelbaum.
You're welcome.
I appreciate it very much. All very helpful information. We'll break for another commercial now. This one is brought to you by our table sponsor, Rondout Savings Bank. When we come back, we'll hear from our New York State Senators Gibson and Katchik to get their take on New York's role in pain and palliative care.
13 years ago, on October 16th, I was diagnosed with breast cancer. And that was where my journey started. And since then, I've been diagnosed with 2 more primary cancers, and I'm currently in treatment for the 3rd of those cancers, peritoneal cancer, right now. During my first diagnosis of cancer, I never even heard the word palliative care used. Over the last 5 years, I've availed myself of palliative care services, and it's made a huge difference in the care that I'm receiving and the way that my family and I view what's going on. Palliative care is so important in cancer treatment because it treats all aspects of the disease, being able to have a coordination of the treatment of the pain, the nausea, the side effects that you have, along with the emotional stress and strain that there is for myself and my entire family, is just huge. The first time I heard the word palliative care, I completely misunderstood it as being end-of-life care, and it scared the heck out of me. Because I said, wait a minute, I don't need this. I'm not at the end of my life, far from it. And then it was explained to me that it simply was care for my disease and all aspects of it that needed to be coordinated. ACS CAN has taken on palliative care because cancer patients receiving palliative care are feeling better with it. I've experienced cancer treatment without palliative care, and for the last 5 years, I've experienced cancer with palliative care, and it has made all the difference in how I am able to cope with this disease. If people speak out to our politicians about palliative care, we have a better chance of making sure that there are more programs to train palliative care specialists. If people are speaking out to other constituents, there's going to be more of a wave of support for that. But at the same time, it's just being talked about will mean that more patients will know what it is and know to ask for it through their providers.
Once again, we are back live with the American Cancer Society Cancer Action Network's Legislative Breakfast. We're here today with our guests, Senators Terry Gibson and Cecilia Katchik. Senators, thank you both very much for being with us today on our program. We appreciate it. New York has faced a number of challenges in implementing these new palliative care laws. The dollars appropriated for the Palliative Care Education and Training Act apparently were never spent. Many providers are unaware of the Palliative Care Information Act and the Palliative Care Access Act, or they confuse the two. What, in your opinion, needs to happen to fully implement these laws? Senator Katchik?
This is a really important issue. Once you do the advocacy and you get something in legislation, you really want to see it get enacted and fulfill its purpose. So when things don't occur, you want to do additional advocacy to get things in place. I think one of the important issues is we have some tools as legislators, such as a forum or a public hearing, to really get on an issue. But I think meeting with the Department of Health, whoever's in charge of that program, and really understanding what are the hurdles to implementation, and really understanding what's keeping it bottled up. And this seems to be an issue that the American Cancer Society and your local legislative advocates can get engaged with, and making sure that we're utilizing the resources effectively and efficiently, and keeping us on task. There's a lot going on in Albany all the time. There's a lot going on in healthcare. There's a lot changing. So really helping us understand what's not working is really important from advocates, and it's important that you're telling us this isn't working and this is something we need to work on.
Can we count on you to be an advocate for us in Albany?
Absolutely.
Great, great.
And this is something that we need to work with you on to really understand where is the issue that needs to be focused on, so that we're getting the education out on how this is so important and really making sure that it does get implemented and out in the community. Because people need this service, and it's so important to make sure it's there when they need it.
Okay, thanks. Senator Gibson, have you had any experience possibly with a loved one or a constituent who has had need of palliative care or might have benefited from it if that person knew that it was available?
I haven't had any personal experience, but I have had friends who have had the experience and have shared their stories with me about what it was like to take care of their loved ones near the end of their life, and they've talked very much about how these services really did help them. And I just want to thank the American Cancer Society for hosting forums like this, because I believe this really is the way to make sure that not only elected officials are educated about the issue, but also the constituents and the other stakeholders. I think part of the problem here is that we haven't done a good enough job at a state level to educate everyone on what services are available, and also holding those accountable who implement the services. And I think it is a partnership, working with you and the elected officials here, learning more about how we can engage and work together, because these are critically important services that we're talking about here. Services that are really not accessible anywhere else in our society, and we're talking about a very much a crisis situation that without this help, there's just no other place to look. So I do want to also pledge my support to work with you and the American Cancer Society in any way we can to move these issues forward.
Great. Loosen the purse strings, hopefully, and get the monies allocated where they belong. That would be wonderful.
See what we can do.
Excellent. Senator Gibson, Senator Kachik, thank you for your time. Thank you for your advocacy and your great work in Albany. We appreciate you being here today.
Thank you.
Thanks again. Thank you. We have another commercial coming up next, and after that, we'll be joined by New York State Assembly members Kevin Cahill and Peter Lopez to discuss how New York State can effectively work toward a unified system of pain and palliative care. Please watch this message.
All right. Thanks.
13 years ago, on October 16th, I was diagnosed with breast cancer. And that was where my journey started.
My family doctor called me and said, the news is not good. You have cancer.
After the doctor says you have cancer, the cancer patient hears nothing else.
Palliative care is specialized medical care that focuses on patients with serious illness. It provides symptom support.
So palliative care is helping patients who are in treatment for cancer basically be comfortable during treatment, whether that means helping them with pain control or other symptoms.
It is important to treat the whole person, not just the cancer.
One of the things that we focus on in palliative care is really the patient-centered approach. Palliative care not only improved quality of life, but also improved survival.
Being able to have a coordination of the treatment of the pain, the nausea, the side effects that you have, along with the emotional stress and strain.
The role of the palliative care physician would be to make sure that everyone is talking. We're dealing with making sure that people can tolerate their treatment.
Palliative care enables families to give the love, support, and be more effective caregivers.
There is this belief that palliative care is focused only on end-of-life care, and that in fact is not what palliative care does.
Palliative care is important to me because it helped me get better. It helped me get through my cancer.
I've experienced cancer treatment without palliative care. I've experienced cancer with palliative care, and it has made all the difference.
It just feels so good to when a patient tells you that their pain is under control and that they're able to go to work and they're able to be with their family.
We need to increase the availability of palliative care.
We're going to undertake policy work that will overcome the barriers that exist today that prevent universal access to palliative care. I want people to write their members of Congress, email them, call them, go to our website, acscan.org. There's a lot of information about there on what you can do.
Good morning again, and thank you for being with us. We are delighted to have so many representatives of ours from Albany and Washington to help shed some light on this very, very important subject, this topic. And with us today is Assemblymember Kevin Cale, who chairs the Assembly Insurance Committee, and Assemblymember Peter Lopez. Thank you both for being here with us today. Good morning. Let's start with Kevin. We've heard before how New York had money appropriated for implementing the new pain and palliative care laws. However, some providers apparently aren't educated enough on the specifics of the law, and the money was never authorized. Can you give us any further insight?
Well, Ward, you know, the legislature proposes and the governor disposes in New York State. So we proposed it, we put it in the budget, we authorized the spending for it, but then the spending was never done because the governor controls the purse strings. I can tell you that happens with some regularity. The governor's job is to make sure the budget stays balanced, and when he or she perceives that it's going out of balance, they have the authority to pull back on spending, and that is exactly what happened in 2008 when we saw the beginning of the Great Recession. The one thing that advocates can do to make sure that that money stays in the budget and gets spent appropriately is to not just let the pressure happen during budget season, but to keep it going on year-round. Our office does advocacy on behalf of organizations that have allocations in the budget that they haven't been able to get. You know, in my office we have a person who does that almost full-time. And it's a very important part of the budget. It's a $140 billion budget. And much of that budget is determined to do something in particular, but unless we make sure it happens for those things that matter, it may very well fall by the wayside.
And so we're talking about a very small portion of that, $4.5 million roughly.
Right.
Is there something that your office can further do, or that the Assembly itself can do to, if it is in the governor's best interest to have this released, see that it's done?
You know, in the first group of panelists that were up here today, we're talking about setting up a statewide group of advocates to sit down and discuss basically the steering and the direction that the state ought to go. That kind of high-level advocacy is very important. But in addition to that, being able to give real-life, on-the-ground practical examples to the agencies that are responsible for dispensing with the money is very important. So if people out there have information about how that money would be spent here in our communities, that's important for me to know, and we can advocate on behalf of them.
All right, thank you for your support on this. Peter, let me ask you, there are many patient advocates and organizations, some who are here today. I'm wondering if you can help them to raise awareness about the prominence of palliative care and quality of life as priorities, so New York State can be a leader in this arena.
I would say absolutely. And when we think about it, really the issue that we're talking about is human dignity. We're talking about empowering individuals. We're talking about providing choices. So it's about information and access. And we've heard some of our panelists speak about that. So back to the issue of priorities. And certainly my colleague Kevin highlighted it very succinctly. Albany has so many issues coming at them. When people come to Albany, they're running at Albany, and they're very passionate about their issues. So whether it's healthcare or education or roads and bridges, whatever it is, there's a challenge that those voices are lost if they're not amplified and coordinated. So our challenge is working throughout the healthcare network, and we know that every person who's involved, and we've heard others beyond healthcare, human service providers, clergy, all play a role. So the issue is working grassroots level, empowering, encouraging, reinforcing efforts locally, but also amplifying that to the state and federal level so people hear a clear voice that this is an important priority. And you know, as we've seen, part of the issue is we have laws on the books. We have budget allocations in place, but it's only as good as to the extent that they're implemented and exercised. They're like a muscle. So if you don't exercise it, it atrophies. So our goal is to really pump this up, pump up the volume, and get people focused on this as a form of empowerment for individuals and healthcare institutions.
We've already heard that this, especially with the baby boomers coming of age now, will be affecting nearly every person or every family. There you go. Any folks in your families or constituents who've had issues that required palliative care, Kevin?
Absolutely. You know, and you knew my dad very well, and he suffered for cancer for actually about 3 years running. And the end of his life was not the best as it could have been. But my father, long before New York State considered medical marijuana laws, took matters into his own hands. And the unfortunate part of that is that was so long ago. More recently, but not so recently either, but still very strong a sting in my heart, is when my mother-in-law was sick and I was with her for the last year of her life. In both instances, we had hospice. In both instances, we had two different kinds of hospice. In the beginning, back when my dad was sick, it was mostly a volunteer organization. By the time my mother-in-law was being cared for. It was a formal organization with nurses involved, and Medicare changes the way that they pay you and all those good things. I can't tell you how much that meant for the improvement of the quality of her life. It was a short period of time between her diagnosis and her death, but I think it was one of the best times of her life. I think it really allowed her to live with dignity for her final years, and that's important to do.
Peter?
I would say yes, and we've had family members pass away from breast cancer, individual family members pass away from colon cancer, and one of the observations I have, and this gets back to the very personal aspect, in some cases the care is being given in the final stages in the home. And so the question is, how well prepared are family members for dealing with pain, for dealing with medications, for providing that intensive support, which is emotional as much as physical. So I would say that that's probably resonated with me the most because you live with it. And that person's suffering is evident. And so your heart, your soul, your whole fiber is engaged in helping this person have their dignity, have their comfort, have their family around them. So it's a multifaceted engagement, but it also boils down to in individual homes and families.
Great. Thanks for your insight. Yeah. Thanks for your assistance. We'll talk with you some more about continuing to advocate to get this money released. Appreciate your time this morning.
Thanks, Ward.
Thank you, Kevin. Thank you, Peter, very much. We appreciate their support and their leadership and commitment to ensure that pain and palliative care issues are front and center in the public health policy debate. Another commercial up next. We'll speak after that with Sandra Cassesi and Neil Eisenberg about how you can be more involved and make a difference. Stay with us.
A surgical oncologist is a doctor who takes care of patients with many different types of cancer as a specialist. The most important part of my job is being able to sit down individually with patients one-on-one or with their family to discuss their problem and what we're going to do to fix it. What we do at HealthQuest is we work in a very large team, people who you will meet, people who you may never meet, to find the best way to treat you.
We never forget the nearly 12 million cancer survivors in America today and the countless lives lost. We owe it to them to protect funding for cancer research, prevention, and access to care. Congress, make cancer a priority and give millions of Americans what they need most.
I have the ultimate responsibility. The buck does stop with me. I'm responsible for quality, I'm responsible for safety. And when I have a team surrounding me that embraces these ideals in a way that just speaks volumes about their character and their ability to do what they do well, I go to bed every single night with a clear conscience, knowing that we've done it right the first time, every single time.
Welcome back. Joining us now on our program is Sandy Cassesi, Vice President for Oncology Services at HealthQuest and Secretary of the National ACS CAN Board of Directors, and her husband, Neil Eisenberg, an ACS CAN Legislative Ambassador, and the person who got me started here, I think, a few years ago, helping out this wonderful organization. So thank you both for all that you do.
Thank you.
Sandy, tell us a little, if you would, about what ACS CAN is and all about how others can get involved in this.
Sure. I have this wonderful job in as much as I am the actual national chair for income development for the Cancer Action Network. Big job. And very often when I'm out on the road, the very first thing that people ask me is, what's the difference between the ACS, the American Cancer Society, and the Cancer Action Network? It's true, they are independent organizations, but they share the exact same goal, which is to save lives and to diminish suffering from cancer. You heard about that so much today. So ACS, the Cancer Society, funds research, provides information to patients and their family and the public on cancer, really helps in treatment, prevention, and early detection activities, and working in local communities to provide support to cancer patients. And of course, my favorite, provides funding for advocacy and public policy work. ACS CAN, on the other hand, is really a national movement. It leads cancer survivors and their families to support policies that help to fight cancer. We work with lawmakers throughout the land. You've seen it here today at the local level, the state level, at the national level, to help in a nonpartisan way to make cancer a national issue. It needs to be a national priority. We join with diverse groups, other groups, in public campaigns that support our advocacy priorities. And we educate the public and lawmakers and candidates about these important cancer issues.
Great, good work.
It is good work. And, you know, people always, in addition to asking what's the difference, is how can we as normal citizens, everyday people, make a difference and help save lives? And I'm going to say to you that defeating cancer through public policy is every bit as important as the work that we do at the scientific level. Okay? Preventing cancer, very important. Defeating it through public policy, very helpful. And every single person in this room actually can get involved in this grassroots movement. There's almost 1 million of us at this point who are part of the Cancer Action Network, and we're growing every single day. So I'm going to ask you today to help us hold our lawmakers. Obviously, we're in a fantastic group here today who are very supportive of these issues, accountable to their constituents for the decisions that they make as they relate to cancer research, prevention, early detection, survivorship, and treatment.
Great, great. And Neil, I know that you're on the phone all the time with our local, state, and federal legislators. Good work on your part. Talk more about ACS CAN and the great work you're doing.
Well, you know, part of what ACS CAN does is we've seen here today. I mean, this forum that we've put together kind of addresses a lot of what ACS CAN tries to do across the country, and that is to start a dialogue with our elected officials, and we've certainly done that today, but this is the kind of thing that takes time. It's an education process, it's an accountability issue, but it really starts at the grassroots level. It's people like all of us in this room who make this kind of thing happen, and the dialogue, obviously we're here with the thanks of our corporate sponsors. We've raised some money for ACS CAN, and in a minute I'm going to tell you how we can raise just a little bit more. And you know, these are the kind of things that we're trying to do. Get our agenda out to the public so people know what's going on, and have the dialogue with the lawmakers. And this is the part of the program every year where I kind of feel like it's a telethon in a way. It's where I appeal to the folks in the room to help us. And you've all probably seen that there's a ACS CAN membership form on your plate, and by filling that out and donating $10 here this morning, or $20,
or 100,
or 100, Kevin Cahill is usually the first one to whip out his wallet every year. Let's see.
No
so that's
pressure.
So that's what I mean by holding our elected officials accountable. But really, that's what we're trying to do today. And I know a lot of you will say, well, I'm already a member of ACS CAN, and that's really great. The good thing about the way ACS CAN is set up is you can join twice. It doesn't matter. So feel free to join again today. We'd love to get your forms filled out. We'll collect them at the door on the way out.
Don't forget about the pins.
And don't forget about the pins. These dancer pins that we're wearing are a thank you from us for joining at the $20 level. So it's not a lot of money, but this is the kind of grassroots involvement that really raises some of the funds for ACS CAN. And you're probably wondering, where does this money go for ACS CAN? And there's kind of 3 main areas that I wanted to highlight. The first is the money that is raised through ACS CAN funds some of these grassroots efforts that we've talked about today. Some of the programs that are going to bring these issues to the front of the minds of the legislators. The second thing is the money goes to pay for some of the training for us volunteers. Almost everybody you've seen here today that's working with ACS CAN is a volunteer. We all have other jobs, and we don't always know the issues in and out. So we go to annual trainings put on by ACS CAN. And the last thing is something that's kind of new to ACS CAN and pretty important, which is for key elections throughout the states and local government and even on the national level, we produce voter guides. And voter guides are quite simply interviews with candidates to get their stance on key issues that affect cancer patients and their families. We put these out to the public, and by getting this information in writing and putting it out there, it's another way of holding elected officials accountable for what they stand for. And we are lucky in this area that we have some elected officials who have been with us for the long term and are going to be with us, even longer. So we're lucky for that, and we're lucky that we have a community who turns out for this event every year. So we thank you for that, and we thank everybody who put this on and came up here and gave us the information that they gave us.
Great. Sandy?
If I may, just in closing, there's a state lead ambassador in every single state in these United States, and there are also advocacy lead advocates in each congressional state in the entire country. And every year in Washington, we descend upon our lawmakers and actually bring forth these issues. It's a sea of blue shirts representing the Cancer Action Network. We make our way into the offices of every elected official. I can't think of a more important way to spread a grassroots message like ours. So when you join, you actually help to support those types of activities. And I can't think of better stewards of your donations than the American Cancer Society Cancer Action Network.
Great. Keep up the great work, both of you. Sandy and Neil, thank you so very much for
Thank
all
you.
you've done.
Thank
Keep
you.
up the great work. It may seem as if this is a highly scripted program, but in fact it is not. And so we're delighted that our state and federal representatives have shown the kind of support that we've gotten today. We never know. We start the program and let's see how it works. We are blessed. We have 4 state assemblymen and 4 state senators here in Ulster County, and we'll continue to talk with them and work with them to ensure that we get federal monies and those 2 bills passed and the state monies released. So thank you again to all of the great work they're doing, and thanks for your advocacy, both of you, Sandy and Neil.
Thanks, Ward.
Thank you.
Please, if you would, before you leave, we're going to have a time for a couple of questions. Please become a member of ACS CAN. Just $10 annual membership or $20 to receive your limited edition Quality of Life dancer pin. They really are quite special. Fill out the envelope on your table before you leave and do that. Contributions or gifts to ACS CAN are not tax deductible. One last thought, ACS CAN, and we love to come back to Ulster County again. We're committed to helping you all finish the fight. So thank you for being with us this morning. And are there any questions folks have in the remaining few minutes we have? Okay.
Good morning, everybody. I'm Kathy McMahon. I'm President and CEO of the Hospice and Palliative Care Association of New York State. And I want to, before I ask my question, I do want to thank all of our senators, assembly members, and congressmen for the incredible support you've given us over the years for palliative care and hospice. My question has to do with individuals who are eligible for both Medicaid and Medicare. We call them dual eligibles. And I'm watching very closely New York State's getting ready on January 1st of 2015 to implement the fully integrated dual advantage program, FIDA. And my question to our assembly members and senator who's still here, are there opportunities as that gets ready to be rolled out to incentivize the use of palliative care for dual eligibles and also incentivize the use of hospice for those folks?
Thanks, Kathy. I'm chair of the Insurance Committee in the Assembly, and one of the things that we deal with there is trying to work out the bugs in the implementation of programs that come down from the federal government or programs that we subscribe to because of our Medicaid waiver or elsewhere. One of the things I will tell you is that we've had a great opportunity to modify all of these programs where it is appropriate to do. So many people thought, for example, that the Affordable Care Act was going to be a point in time, that one day there was not going to be an Affordable Care Act and the next day there was. That's certainly not true. It's a transitional period, and there will be adjustments, just as there have been adjustments to things like the Child Health Plus program over the course of time. So yes, there will be great opportunities to look for chances to incentivize particular care modalities, and also to recognize the unique needs of dually eligible people. Dually eligible individuals are people of great need. They have extremely expensive healthcare needs, and getting control over that cost hopefully will also mean improving the quality of that care. We can't do that unless we listen to the providers and find out what the care is that's needed.
Okay. And Cece, I think, wanted to comment?
I just wanted to agree with Assemblyman Cahill, and just to say that when we see that there are opportunities to make these issues relevant, you need to contact us and get us involved and help us understand how to do things better, because as I said earlier, there is so much changing in the healthcare field. We have to make sure that as things change, they change for the better, and that the patient's needs are what's most important. And my response to anything that you ask me, why can't we do something this way, would be, why not? And let's work on how do we make that happen. And that's something we have to do year round. And I love events like this because you're educating all of us on what's the most important issues to focus on and where to put our advocacy efforts. So I look forward to working with my colleagues in the Assembly and Senate on issues like that. And I thank you for bringing them to our attention, and let's work on them together.
Great, Senator. Thank you very, very much for your attendance and for your support. I do want to mention before we conclude that this is really a special event here in Ulster County, made possible by our great friends at 721 Media Center. They transform the Garden Plaza Hotel into the set of the Today Show practically. So Jeremy Ellenbogen and his staff, a special round of applause, and thank you for all you do. And that is our program for today. Thanks again for being with us and for supporting the American Cancer Society and the Cancer Action Network. We have one final commercial. Have a great day. Thanks again for coming.
When I found out I had breast cancer.
When I found out I had throat cancer.
When I found out I had prostate cancer.
When I found out I had lung cancer.
I turned to Orange Regional Medical Center.
From diagnosis to treatment, to rehabilitation and support services, you don't have to go far to battle cancer. The Comprehensive Cancer Program at the Spagnoli Family Cancer Center includes a team of experienced physicians and certified oncology nurses who specialize in treating many types of cancers. The team is backed by advanced technology and compassionate staff that personalize your cancer care.
A nationally accredited program.
Right here at Orange Regional.
Can help you enjoy life again.
And do the things you love doing.
At Orange Regional Medical Center, we can fight cancer together.